Good afternoon, good morning, good evening, wherever you are joining us from today. Welcome to today's City's Health Talk. My name is Joe Jewell, and I will be guiding us through the next hour as we explore the topic of health equity. It's a concept that is widely discussed, but not always fully unpacked or put into practice. Throughout today's webinar, we'll be hearing from some world-leading experts at the international, city, and local level who can really bring the concept of health equity to life. But at its core, health equity means everyone should have a fair chance to live a healthy life. Yet around the world, we know that those chances are not equally shared. From unequal income and education to gender and postcode, there are many barriers in day-to-day life that can impact opportunities for good health from the start. This is definitely not about individual choices. This is actually about the systems, the environments, and the policies that shape people's daily life and determine whether or not health is attainable. Today, we really want to move beyond the buzzword and unpack the concept of health equity and work out how it is actually put into practice to drive long-term positive health impact. What does it look like in practice, and how can we turn equity-based approaches into lasting change? To take us through this topic and to bring these questions to life, we're going to take a holistic approach in this webinar today with three speakers who bring different perspectives from the global, the city, and the community level. We'll also bring case studies from Brazil and Finland to put a face on the challenges that we're trying to solve and the impact that equity-based approaches can have. As always, we invite you to participate as actively as possible, so please do introduce yourself in the chat, say where you're coming from, what you're working on as it relates to health equity, and of course, to add as many questions as you want throughout. We have plenty of time towards the end of the webinar for a Q&A discussion. But let's get started today by first introducing the wonderful list of speakers that we have to unpack this topic of health equity. So today I'm joined by three speakers, as I mentioned. Firstly, we'll hear from Sudhir Singh, who is Unit Head of Equity and Health at the World Health Organization headquarters, joining us from Geneva. Sudhir leads the work of WHO on the social determinants of health and how to advance health equity globally, helping to develop the frameworks and strategies that can guide action around the world. Next, we'll turn to Finland, where Markus Kalmari, who is the director of the sports department at the city of Turku, will share how an innovative sports voucher program breaks down barriers and expands access to physical activity for children and adolescents. Then finally, we will move to Brazil with Julia Vergueiro, who is the founder of Nossa Arena in São Paulo. Julia leads our Football for Better Health work, which is a community-led initiative creating safe, inclusive spaces for girls to play football and to build confidence and well-being. So thanks all of you for joining me today. It's a really interesting lineup, many different and diverse perspectives, and hoping for a really, really good conversation. Before we begin with our first speaker, let's watch a short video that asks a simple but important question: what is health equity?
Meet Kai and Maya. They both live in the same city, but their neighborhoods are very different. Kai's neighborhood has a grocery store full of fresh fruits and vegetables, clean parks, and safe streets. He can ride his bike and play outside every day. Across town, Maya's neighborhood doesn't have these things. The nearest store mostly sells prepackaged processed food, and there's no safe place for her to play. As a result, Maya doesn't have the same opportunities for a healthy life that Kai does. This difference in opportunity is shaped by where they live. Health equity means closing this gap. It's about making sure both Kai and Maya have a fair chance to live a healthy life. But health equity doesn't mean treating everyone exactly the same. It means understanding that Maya faces extra hurdles and giving support where it's needed most. Changes like these don't happen by accident. They happen when neighbors, community organizations, and local leaders work together and make fairness a priority. Our health is shaped by daily life. It's in the food we eat, how we get around, our homes, and whether we feel safe and supported. By focusing on equity, we can tackle the root causes of poor health and build stronger, fairer communities. Health equity isn't just possible. It's a choice we make together.
Well, that definitely gives us a clear starting point for today's discussion. It's a very complex topic, but it's one that we can only help unpack through conversation, dialogue, and also guidance from global organizations such as the World Health Organization. So let's first start at the global level. And Sudhir, who is really one of the world's experts on this topic and really trying to understand and help communicate to policymakers, work with them to unpack the concept of health equity and also think about how we can turn that into meaningful action. So he's beaming in from Geneva today, and we're really pleased that he's able to join us. He'll be talking about precisely some of these international frameworks and guidance from organizations like the World Health Organization, how they can guide action on health equity worldwide. We're really looking forward to hear from him around why the concept of health equity matters, what the frameworks are that can guide our work globally, but also hopefully he can round out with a nice call to action for all of us around the world working on this topic. So Sudhir, the floor is yours, and thank you very much for prioritizing to be with us today.
Great, thank you, Joe, and thanks to the whole City for Better Health network for convening this important discussion. Just to say, we as WHO are very pleased to be here as an invited speaker. If you go to the next slide, please, based on our framework of engagement with non-state actors, our presence here doesn't imply endorsement of any of the entities or products here. If we go to the next slide, please. So you're right that health equity is being used a lot now in discussions, which in many ways is great, but it's really important to be precise about what we mean. So here on this slide, you can see the technical definition of health equity from WHO, the absence of unfair and avoidable or remediable differences in health between population groups. So what this doesn't mean is that everyone is going to live exactly the same number of years or have the same types of lives. What this does mean is that at a population level, there shouldn't be a difference between different groups which are avoidable and remediable, which means they don't have to happen. There's something we can do about these things to prevent these differences, and that they are unfair. And it's this justice element that is really the difference between health inequity and health inequality. So health inequities are differences in health outcomes between groups according to where you live, how much money you have, how much education you have, but also importantly because of identity. What gender you identify as, what is your race, ethnicity, your sexual orientation, the way you present to the world, whether you have a disability or not, etc. And what we know is along all these so-called stratifiers, there are tremendous differences in health, both between countries, but also within countries and within cities. And these are avoidable. And these differences are not due to genetics or biology, but they are due to the conditions in which people live and their access to power, money, and resources. And together, these latter two things are the social determinants of health. So when we don't have health equity, we don't allow people to realize their full potential. That's unjust, it's unfair, it violates their rights. And then in turn, we as a society are compromised because we don't have the capacity of all of our members. So if we go to the next slide, please. Why has WHO produced a new world report on health equity, and why now? Well, at the peak of the COVID-19 pandemic, it was very evident that the impacts were deeply inequitable, both between and within countries, and that pre-existing inequities were making the pandemic worse. And against that backdrop, our member states came together at the World Health Assembly and through a resolution requested an updated world report summarizing the latest evidence, putting forward a framework and providing concrete recommendations for how to reduce health inequities. The resolution asked for WHO to build on the landmark Commission on the Social Determinants of Health, and you can see their famous high-level recommendations here on this slide. And in the first part of the world report, we look at how progress against the targets the Commission set to close the gap in a generation. And there's a lot of interesting data in the report, so please have a look. But in summary, as you can see on this slide, there's been some progress narrowing gaps between countries. For example, we've managed to see a halving of child mortality rates in the past 2 decades. But that progress is stalling. And what is really worrying is that when we look at what is happening to health inequities between social groups within countries, the gaps appear to be widening. And that's whether we look at comparisons of people based on their income, their education level, their ethnicity or race. Where we have data, in many places we are going backwards. So if we go to the next slide. What is the diagnosis? What is the reason for this? And most importantly, what can we do about it? Well, the second part of the report presents a framework for understanding the drivers leading to poor health and health inequity, and it builds on and updates the framework developed by the Commission. So if you make a click, please, we start with economic systems. And key trends here relevant to health equity is the fact that income inequality within countries has increased substantially over the past 2 decades. We're seeing wealth becoming more and more concentrated. We also look at social infrastructure. What we mean by that are the policies, services, and places that allow people to fully participate in their societies, and how societies have to adapt to forces like urbanization and demographic shifts. We know, for example, that tax systems are underperforming, leaving 3.8 billion people worldwide without any social protection coverage. If you click again, please. We recognize that too often discrimination is embedded in institutions, norms, and policies, including the intersection of structural racism with gender inequality and discrimination based on class, sexual orientation, age, and whether or not you have a disability. We also recognize the grave health impacts of conflict and forced displacement. People living in conflict settings have the worst health outcomes, and 2024 had the most conflict recorded in the world since the Second World War. We're all seeing these humanitarian tragedies play out in front of us, and tragically, there's been a tripling of forced displacement in the last 15 years. If you click again, please. And now we also observe that the world is fundamentally being reshaped by mega trends like climate change and digitalization, which have direct health impacts. So unless we recognize and address these underlying structures and trends, we will always be playing catch up when it comes to improving population health and achieving health equity. And if you click again, we'll see that these structural determinants in turn shape the living conditions that are the building blocks of health that you can see here on the right. And I know that so many people in this network are actively working on some of these really important issues. Issues like early childhood development, education, work, and the types of food, housing, and transport that we have access to, as well as more recently recognized areas in public health like social isolation and social connection. So the remainder of the World Report focuses on the evidence behind concrete actions to address these structural determinants and how we can learn from and be inspired by actions already taking place all over the world in countries and cities. So there are over 1,000 scientific references and over 33 case studies, so please do have a good look at the report. And I'll now give a quick overview of some of the action areas and recommendations. So if we go to the next slide, please. So the first action area looks at how we can address economic inequality and invest in universal public services. So the report speaks to the importance of progressive taxation. What we mean by that is that the wealthier pay proportionally more to allow investment in universal public services. We call for health equity to be central to international discussions on tax loopholes, on debt distress, and on trade. We focus on the need to address the commercial determinants of health, regulating health-harming industries, addressing conflicts of interest, and optimizing the health-promoting capacity of the private sector. And we also look at the need to expand social protection coverage across the life course, such as through sick leave and child benefits. If we go to the next slide, please. The next chapters look at what can be done to recognize and repair structural discrimination and to protect the social determinants of health in emergency and conflict settings. If you click again, we then look at how megatrends can be steered towards health equity, how we can accelerate climate action and the preservation of biodiversity with the inherent co-benefits for health and health equity, whether that's through transforming food systems and improving food environments, addressing the emissions in our transport system, addressing energy poverty, or mobilizing the health and care sector as well. And then we have to make good on the immense promise of digitalization for better social and health outcomes by putting equity at the center and managing harmful impacts, whether that's in the information environment or threats to social cohesion, such as cyberbullying or precarious gig work. If we go to the next slide, please. So bringing this all together, the report then looks at how we can govern and make decisions in the interest of health equity. It emphasizes the importance of equipping local government with the mandate and resources to take action for health equity in areas like housing, transport, and urban planning, where so many people here are engaged. And I'm looking forward to the concrete actions my fellow panelists will share in regards to this. We talk about the central role of communities and civil society, ensuring that those who are most affected can be at the center of decision-making. The report recognizes the importance of achieving universal health coverage, particularly through a primary healthcare approach, including the need for equitable access to health technologies. We look at the need for a well-capacitated and supported health and care workforce, which walks the talk on equity ourselves, for example, by addressing discrimination within our own ranks, such as in the care economy. We look at the opportunity for data and monitoring to inform concrete policy action. And finally, the report concludes with a call to action, emphasizing that health equity needs to be a central focus, not just of health systems, but of governments and cities as a whole. So Joe, I'll stop here for now, and I'm looking forward to the discussion.
Thanks so much, Sudhir, for that important contribution from the WHO and also the perspective from the global level. But also, I mean, one of the things that I took away is, of course, the key message that if we're really going to tackle health inequity, it requires structural interventions at multiple levels across different systems of government, policy change, legislative, but all the way down to local level and programmatic change as well. So I think it's really a key takeaway that it's not one solution that's going to address health inequities, but really a package of interventions. I think when you were introducing the concept of health inequity, I think embedded in what you were saying, you were trying to clarify also about the ways in which sometimes health inequity or health equity can be misunderstood. What are some of the common misconceptions that you hear about the topic or the effort to address health inequity, and how do you respond to them in dialogue with stakeholders?
Mm-hmm. Thanks, Joe. I think one of the most common misconceptions is that health equity is just about access to healthcare. And the World Report and our community makes clear that health equity is about the conditions in which people live, work, and age, and it's a whole of society issue, as you say. So yes, healthcare matters, it's fundamental, but it's only part of the picture. And if we don't address things like income security, like housing, like education, like discrimination, we won't be able to close health gaps sufficiently. I think another misunderstanding is that health equity is only relevant to the poorest countries. And in fact, while there are still major gaps between countries, our report shows that people who live in the highest life expectancy, the country with the highest life expectancy, will live on average for 33 years longer than in the country with the lowest life expectancy. Inequities actually exist within every country and every city and are often getting worse. And crucially, achieving health equity doesn't mean someone has to lose out. It means that everyone improves, but those that are furthest behind must benefit the most. And that's what we mean by a so-called leveling up approach. And when we do that, we build a more strong, a more cohesive society for everyone.
Thanks so much, Sudhir. That's really set the scene brilliantly for the rest of the conversation. We will come back to you during the panel discussion. Right now, you're relieved and you can listen to the other speakers and enjoy it. But it's definitely inspiration. And of course, all the messages that Sudhir was describing there are core to the Cities for Better Health program and our approach when working with local partners and local government. So moving from the conceptual frameworks and the global strategies, we'd like to now move down to a closer bit to the local level and people who are working on policy at the city level. So I'm going to invite Markus here from Turku, who is going to talk to how the city of Turku is expanding access to physical activity through the Busti benefit, which is an innovative sports voucher program. We'll start with a short video about the initiative, and then Markus will give us a presentation about the program itself. So let's watch the video.
Welcome to Turku, Finland, a city that believes every child should have the chance to participate in sports. But opportunities are not always equal, and for some children, affordable activities are out of reach. That's why Turku created Busti Benefit, giving every 7 to 19-year-old an annual voucher to join sports activities. Busti aims to enhance the well-being of children and young people while preventing social exclusion. It promotes equity across age groups, genders, neighborhoods, and opportunities for sport. Through hobby days that introduce different activities, the creation of new, easily accessible sports groups, and training for their coaches, Turku wants more children to discover the joy of physical activity. Already, more than 9,000 children have used their vouchers. In Turku, Boosti benefit is more than a voucher. It's a commitment to help every child be active, build confidence, and find a place to belong.
That's a great introduction to Turku's approach, and now we have Marcus joining us. So Marcus, could you tell us a little bit about why the city introduced the sports voucher program and what problem were you trying to solve? I believe you have a presentation for us, so the floor is yours.
Good afternoon from Finland, and thank you, Joe. And thank you all for your interest to listen what we are doing in the city of Turku. So, is it my presentation on? Okay, thanks. First slide is fine. Yeah. Yes, this is fine. Well, at the beginning of this year, we started a new sport policy and funding system. It means that we give sports vouchers to all from 7 to 19 years old Turku citizens to cover sport club fees. Most of the cases, it helps step in or stay in the sport club activities. Voucher, it's a really practical and transparent sport policy tool where the interests of children and adolescents are clearly noticed. Our goal is to give equal opportunities to participate in the physical activity programs in the sports clubs. It's important also to notice that behind the sports voucher, there is a digital system, and it works also as online database for us. So as a city, we can follow the kids' activity level in sports clubs and different postal code areas, differences in attendance between age groups and sports. We can go on next slide, please. Thank you. So how we started? Few years ago, we really deep dived to collect data from different sources. We collect data from children, adolescents and their families, schools and sport clubs. We found that our existing support system was not equal. Families with lower socio-economical status and certain neighborhoods were less active in the sports clubs, and there was a clear connect to lower physical fitness level also. We found also that we had 3,600 children and adolescents without sports hobbies, but they were willing to participate, but couldn't because of various barriers, such as high costs, lack of time, long distance to facilities, too much competition in too early ages, and what is important also, lack of fun. So we wanted to make a system level change and lead it based on data. We can go on next slide. Thank you. How we can ensure that everyone receives support? We follow results and impact of voucher system. Here, online data is very important. We listen hobby wishes very close. We co-create and organize easy access sport groups and free tryouts with all stakeholders. Schools and families and sports clubs are playing key role in this. And also very important is guidance, targeted communications and outreach and a collaboration with local stakeholders. Okay, we can move on next slide, please. Thank you. Okay, and results so far. This is At this morning, sport voucher was used for payments by 9,500 kids. And we had approved benefits for 11,000 kids. And we have granted this morning 2 million euros for sports vouchers to be part of sports clubs. So what do the families say? Families have reported so far that system is easy to use. But we have not reached yet all the families and not collaborated with all local sports clubs, so there is still work to do. We have noticed that there is a need more neighborhood-based sport clubs, and we need more sports facilities in certain areas of the city, for sure, in the future. Our goal is by the end of the 2030 that there is 17,000 kids in the sports clubs, and there is a better physical fitness level among the children and adolescents. Next year, we need to evaluate already our system and try to improve it. We try to evaluate as often as possible to make the right decisions so we get the right impact, what we want to. And last slide, please. Yes. Finally, some ideas if you get interested in to develop your own sports voucher, perhaps. First, collect data from all stakeholders and collaborate. Take your time. Set the children and adolescents at center. Set a goal. Co-create. Remember to co-create. It's really critical phase. And get ready for a marathon. This is not a sprint. We don't believe that we can do big change in 1 year. It's gonna take many, many years because of this issue is really complicated. It's not all about money. It's much more other things also. And evaluate, do changes if needed. Yes, thank you for all listening our presentation, and thank you a great cooperation also with Cities for Better Health program.
Thank you so much, Markus. That was a very nice presentation and a very practical presentation about the work that you're doing in Turku and how you're learning as you go. I think one of the takeaways from me was that it was data-driven from the start and data-driven all along now. You know, you're already looking at the data to understand where are the gaps, which are the places or neighborhoods where perhaps participation is lower than expected or facilities are not available or to the community, and tweaking your system in order to get to a better place, but already big achievements. So congratulations so far, and thank you for the great collaboration as well. Let's move on to our next example now from São Paulo, and then we'll come back to a panel discussion. So please do submit your questions as we go along. But as I said, we'll go to São Paulo now, where the change is being driven from the ground up via the Football for Better Health program, which is a community initiative using football to transform the lives of girls and young women. Let's take a look at a video before we go to Julia.
In São Paulo, Brazil, girls in underserved neighborhoods face substantial barriers to physical activity. Significant socioeconomic disparities often exclude them from practicing sports, and 91% of teenage girls in São Paulo engage in less than 60 minutes of physical activity a day. Football for Better Health is changing that, so girls can be themselves and harness the power of sport with their friends. The initiative creates safe, inclusive spaces where girls can play football with confidence in their communities. A partnership between Instituto Nossa Arena and Cities for Better Health, Football for Better Health trains local leaders and coaches to combine sport with mentorship and health education. Already, 40 leaders from 20 grassroots organizations have been trained. 7 are now part of a long-term program, aiming to reach 650 girls with football and mentorship this year.
Eu amei muito aqui. Quero vir para cá mais vezes. E tem bastante arenas para as meninas jogar.
Each pass brings these girls confidence, leadership, and healthier futures. That's how Football for Better Health advances equity, one game at a time.
What an inspiring video there, and I'm really excited to hear more from Julia. So welcome, Julia. Thank you for being available to join us your morning. I'm looking forward to your presentation about Football for Better Health so that we understand a little bit more about what inspired you to initiate the program, what differences the program is making in the community and for the city, and perhaps a little bit of inspiration about what others can learn from your experience. So the floor is yours, Julia.
Thank you for the invitation. I have to say it's an honor, but also a big responsibility to speak in the name of Instituto Nossa Arena, but also in the name of all the organizations that are executing Football for Better Health program. They are actually the big stars. I'm here just representing everyone. So to answer your question, Joe, about what inspired me, I have to say that going back to the first video we saw, I feel represented by the little boy that had access to many sports infrastructure when I was a child, nutrition and health education. But I know so many Mayas in Brazil, many girls that are excluded from playing football. And when it comes to girls from underserved communities, it's even more difficult, and they face many barriers. So this is the challenge that we are trying to tackle, and me personally trying to connect my journey and giving back to the society the way I can. So moving to the first slide, please. I like to start the presentation talking about something that I see that many people still don't know, that it's about the ban that we had in Brazil for almost 40 years. So everyone sees Brazil as the country of football, but actually for girls and women, it wasn't allowed for us to play from 1941 until 1979. So it's a very recent prohibition we had, and for sure it has brought many barriers for us until today. And at the same time, we have this big challenge in terms of health for girls, which is teen pregnancy. We are, I think, the first or the second country in the world with the biggest number of teenagers getting pregnant. So it says a little bit about the huge challenge we have here. If we move to the next slide, we'll have some testimonials, and little Manu was the one talking in the video. Because for us, the main impact is listening that for them, this is the place where they want to be. Because I think this is what we are actually changing, their self-confidence, and they're willing to participate in sports and getting all the benefits from it. So we have these two testimonials saying that they love playing football and that they are learning that they can play and that they can play with their friends. So the impact is also a lot about unity between girls and women, which is also something very challenging. And we see so many of them talking about freedom, which I think it's very impactful. You know, they feel free, it makes them forget of their problems, and it's the space where they just feel safe and belonging to their own community. Moving to the next slide, I will talk a little bit about the benefits. And I know Sadhvir talked a lot about health equity and how important it is, but it's specifically for girls, and even more here in Brazil. We know this is very important because many of them, almost half of the girls, drop out of sports when they are in their 11 to 14 years old, which is a 6 times higher rate than adolescent boys. Um, so we need to make sure they stay. It's not only about bringing the girls to sports, but making it a safe and interesting place where they want to keep staying and calling their friends to play with. And we know that this changed their reality out of the playing field in terms of health, like we have here, less likely to get breast cancer, higher bone density, which reduces osteoporosis, that it's a big health issue for women, lower rates of depression, which is something that we saw raising so much during and after COVID. And the good thing is that when they are playing in a way they have this safe space, they get inspired to challenge traditional gender roles. So it's not only about feeling that football is for them, but feeling that becoming a doctor is for them, becoming a scientist is for them, and getting the confidence that they are able to go after their dreams and break down these barriers. And that's how we move from to a cultural change, right? Because they will be the women challenging the stereotypes in the future. So moving to the next slide, please. This is how we created and how the program is tackle these barriers and creating these change. So what we did first is we called 20 NGOs to participating in a training program. And the idea here was to first connect them and create this network of grassroots organizations that are spread around São Paulo, and many of them did not know each other, did not know the work they were doing, but they were all interested in how can I execute a girls football program in my community. So during these 2 weeks, we talked about how to create a safe space, why is it important, how to connect with the families. We had the leaders of the project, but also the coaches participating. So we had a lot of football training activities to show them and to give them tools to work with the girls. And again, to make the training local interesting for the kids. And after the training program, we opened a call for proposals where these specific NGOs, they could apply to get funding and technical support to execute their programs. So now we are going through the project execution. We have 7 organizations from 7 very different realities and communities around São Paulo that are calling the girls and giving them the training, the football trainings and the mentorship, and talking about health education and habits, you know, many things around playing football. Moving to the next slide. Thank you. I also have some testimonials from the coaches. Again, I said in the beginning, they are the big stars because they are the ones that are with the girls on a daily basis. So they understand their realities and they are the inspiration that they need to play and to continue playing. And what they say is that they are not only changing the perspective of the girls about themselves, but also the perspective of the community about what girls can do and what they are able to achieve. So little by little, they're actually giving these girls a voice in their communities. And plus, they are developing themselves as soccer coaches. And this is also another barrier that we have here. Most of the soccer coaches, football coaches are men. So it's still a hard environment for women to participate. and it's nice to see how it's changing their perspective and the way that they treat the girls and the football for girls in general. And finally, moving to the next slide, we have the big numbers. So we just started the program in January of this year, but we already have the 20 organizations mentored. The other organizations who did not get the funding and the technical support to execute the program are also doing other programs, and they have been sharing this with us, which is very, very interesting. We are attending now around 350 girls in the 7 different communities and impacting more than 1,000 people in the vulnerable areas, because it's not about the girls, but also their families, the parents. I didn't bring testimonials from parents, but we have so many saying that they are seeing how their kids are more participating in not only sports, but in school, and they're more disciplined. So they are actually seeing the change, and that's very important because we need their support to keep bringing their girls to the training sessions. And I think the next slide, we have some tips. Yeah, so this will be a resume of our best practices. As Marcos was saying, the co-creation and listening to the organizations, listening to the community, it's crucial. So we started the program by bringing them together because we needed to understand their reality and to share their perspectives, and then start executing the program instead of just thinking from our head and then it may not work for their realities. We had this mentorship before they developed the program. So again, the 2 training weeks were very important for them to understand what was important to have in their project. So it wasn't only them thinking alone and then sending the applications through. We actually co-created their applications from the beginning. And the implementation is being done by the community. So it's not someone from outside that comes, like a coach from outside that comes and do the training session. It's someone from the community. It's someone that the kids and the families already trust. And we know that trust is very crucial to make sure the girls stay with us and to make sure the solutions are appropriated for the territory. Sometimes we talk about vulnerable areas or underprivileged communities. This is not a one thing, they're very different from each other. So we need to make sure that they create the solutions that are appropriated for their own community. And I think this is what I have. I'm not sure if the next slide has something. If not, yeah, thank you. I'm here to share more and to answer any questions you may have. Thank you.
Thank you, Julia. It's always good when you think you've finished your presentation and there's no more slides afterwards. So it's good. Thanks very much for that brilliant example from Football for Better Health. I think one thing that I took away is, of course, a lot of the things that Sudhir mentioned in his presentations that can be drivers of health inequity, sort of like unfair or unfair gender approaches, unequal or inequitable income distribution, place of residence, all some of the challenges that you're working with in São Paulo. I really take away as well that, it's not one size fits all and you have to adapt it for the community. And then finally, also that it's about health and well-being. So, this concept that health and well-being is not just the absence of disease, it's also the mental well-being and mental health of the girls. And that's something that you definitely offer through your community. So I'd like to invite the other speakers back on for a little bit of a panel discussion now, and also a reminder to participants online that we can have your questions submitted. I can see a few coming through here now. I mean, thanks a lot to the panelists for a really a great and inspiring set of presentations that cover, I guess, in a way, the full gamut of what is needed and necessary to address health inequity, starting through a lot of the structural and wider policies and investments and changes that are going to be needed at the international, but certainly the national level, through to changes that cities and local government can make through changes to their policies and investments, all the way down to grassroots and community-led initiatives that are super important for creating the bonds in the community. I mean, Sudhir, if I could start with you with a question just around sort of, I guess you went first in the presentation cycle and you listened to some reflections. Having heard the conversation today, what do you see as some of the key gaps that we're working with, and what are some of the challenges we need to address further? So how do we close that gap in advancing health equity, based on what you presented, but also what you heard from some of the colleagues today as well?
Thanks, Joe, and thanks to the panelists. That was a wonderful set of presentations that were, extremely concrete and extremely inspiring, that very innovative action is taking place in different parts of the world. But unfortunately, the backdrop is challenging, right? I think we could be honest with each other in this conversation. Equity is a concept that's under threat, and we need to really use all our resources to make the case for closing health gaps and the case for public health and health equity. I think some of the approaches to do that is, of course, the moral case. It's unfair, this is based on rights, but I think there's also a very strong material case for health equity, particularly in this time of so many challenges, intersecting challenges that every country, every city, every society is facing. And actually health equity is the infrastructure that brings us together and helps us actually navigate these challenges together. As Sir Michael Marmot says, health equity is ultimately a measure of what is a good society. And then in turn, by having health equity, we know that we will have a more productive society. Healthier people are able to work. We'll have a society with greater trust. And the last project mentioned how important trust is, and that's under threat around the world as well. And it means we inherently have stronger institutions, stronger governance processes as well. So I think we're also making the moral case, but supplementing that with the actual investment case for health equity and why it's more relevant than ever.
And if I could just follow up with one question that was also targeted to you, I think, could you elaborate? I think in your presentation, sort of, you spoke to the idea that moving towards a more equitable society, lifts up and levels up those who need it the most, but overall it benefits society and the population as a whole. Could you speak to that? Because one of the questions from the audience is, asking about the choices that need to be made in order to invest in lifting underserved population or disadvantaged communities up. How do we actually see it as an overall picture in terms of the overall gains from having a more equitable society?
Mm-hmm. Yeah, I think that's an important area. We really advocate for a leveling up of health so that everyone has better opportunities, but there's disproportionate benefit and focus on those who are most left behind. And so we use this concept of what's called proportionate universalism. So universal, so everyone has access to a service, but there's greater need at those who need it most. So we prefer that to then just pure targeting approaches, because we want to bring everyone alongside us. And also, as I mentioned previously, by doing this, everyone benefits. And society as a whole benefits, and we all benefit from that. And that's particularly in the case, we saw that so clearly with the COVID-19 pandemic, that, where there were fractures in society, the pandemic was basically worse for everyone. So by addressing these inequities and vulnerabilities upfront, we can then have a stronger basis to wrestle with whatever threats are being thrown at us as a society.
Super. Thanks. We'll give you a break from the grilling now, but thanks for the really good answer to that one. Coming to you, Marcus, I think one of the questions from the audience is also around the fact that people understand that the city of Turku, as the sort of local government has actually decided to invest in this policy and has an ambition to potentially, continue it, maybe scale it up. What do you think is for other cities around the world? What advice would you give to convince policymakers or to, sort of persuade decision makers to invest in programs like the sports voucher? Because in many parts of the world, it's hard to convince policymakers to invest in these types of city level policies that can make a change for underserved communities.
Okay, thank you. That's not an easy task. It took also for us quite many years to collect data, and based on this data make an analysis and talk with the politicians what are our goals and what we are trying to achieve. And it is, in this matter, it's kind of difficult to give advices, but one key point what I think was success for us that we created a transparent system and database. So and we had this information that we have quite huge polarization what comes to participation of sports clubs. So I think answer would be something like this.
Yeah. So basically go out, try to find the evidence base that there is a problem, show the story, maybe bring a human face to the challenge, and then hopefully you get policymakers on board. Thanks, Markus. And then a linked question, Julia, from the participants is also around the Football for Better Health. It sounds like it's not yet integrated in a city policy in São Paulo, right? It's a community-led initiative, and so one of the questions is around, how do you aim to get it integrated, or what is the sustainability of a community-led program like that? I know that's a difficult question because sustainability and funding is always challenging, but perhaps you've got some reflections.
Yeah, thank you, Joe. For sure, it's challenging, but I mean, that's what we do every day, right? Facing challenges. I would say that we are actually already seeing some sustainability in the program, although it's a very new program. This week, we just gathered the leaders and the coaches of the NGOs who are executing the program, and we actually got a surprise for one of them. To say that she had her project approved by the Federal Law of Sports that we have here in Brazil, and that she's getting a funding which is like 4 times bigger than the one that our program is able to give to continue her Football for Girls program in her community. So it's very interesting to see that, again, the 2 weeks of mentorship and the whole network we created has helped these NGOs to build their own structure and their own way of finding resources. So they're not depending on the program anymore. So next year they'll be able to, walk with their own feet. And I think that's very important in terms of sustainability. But also we advise the organizations to make connections with local authorities, local schools in their communities to make sure they're not doing something that it's only, about the organization, but it's connected to the whole territory. So one of the organizations, they have now a partnership with the university of their neighborhood. And the psychologists that are working in the program are actually from the university. So it's a way to first get resources without having to spend money, but second, to connect the program and the girls with other people and institutions from the community. And we know this is a good way to make sure the community itself will, we'll try to keep the project going, So if they understand this is important, they are connected to the girls and they have a real connection, like emotional connection, it helps them to continue. So I think these are two examples of how it's becoming sustainable.
Thank you. Sudhvira, I come back to you for one final question. I think is, the topic of health equity is inspiring, challenging, emotional. In your work, what is one of the things that has surprised you about working on health equity, and what do you think is also needed to keep it high on the political agenda moving forward?
Surprised me, I think it's the enthusiasm from learning from what other sectors are doing, coming from the health sector. I think equity is actually often embedded in how other sectors approach work, for example, in education. And I think there's so much we can learn from by working together across societies, across sectors. And I think at the urban and city level, that's just so clear. We heard that in our presentations from the panel, that at a local level, it's just so much easier to collaborate and work together and solve problems within our community. So I think there's a lot of inspiration there and that we need to tap into. I think for the health sector ourselves, there's a lot we can do, both in terms of walking the talk within the workforce, whether it's also when we're designing health services, we can be mindful of the climate impacts of those services. And there's a lot of innovative work happening there as well. So I think it's using whatever tools you have available to make a difference in your local society, your local community, whilst also being open to collaborating, supporting, getting in behind. And I think, as a health sector, we're not used to that. We're so used to being the leaders and the knowledge bearers for providing health services and having that expertise. But I think a lot of work on equity requires actually being a bit more humble and coming in behind and supporting others who are on the front lines, who are doing innovative work like we heard from today, and offering whatever we can and whatever they need from us to support them.
Super. Well, that sounds like a perfect note to end the session today. Thanks so much to the speakers. I come away very inspired that it is possible to make a difference on health equity, also rolling up our sleeves, and as Sudhvir said, talking to other sectors and saying, how do we take a whole of society and a whole systems approach to solving some of these societal challenges so that people have better health and well-being? That brings us to the end of today's Cities Health Talk. Thank you so much to our inspiring speakers, Sudhvir, Markus and Julia, who really were generous in sharing their insights, expertise and experience. Thank you all for joining today, engaging in the conversation. It was great to see as many questions coming in, really getting to the point, but also for your commitment and joining us in the efforts to accelerate change in urban health across generations. Until next time, take care, and we look forward to seeing you all at our next City Health Talk, which takes place on the 10th of December, where we'll be talking about our Healthy Cycling Challenge and presenting the winners of the challenge together with our partner, European Cyclist Federation. Thank you for today, and see you soon.
Thank you.